Good afternoon, everyone, and on behalf of the NSCA Foundation, welcome to today's webinar on 5 practical steps to delivering meaningful outcomes from risk assessment. My name is Maxine, the event manager here at the NSCA Foundation, and I'll be facilitating today's webinar. Before we get started and introduce the presenter, I'd like to share a bit more information about the foundation for anyone that is new and joining us here today. The NSCA Foundation is a peak body established over nearly 100 years ago to advance workplace health and safety. Our goal is to keep members updated on the latest regulatory and compliance issues and to promote best practices and insight through success stories and networking. Our membership comprises of individuals and organizations responsible for the safety and well-being of Australia's workforces. Our webinar series is proudly supported by EcoPortal, Australasia's leading health safety risk management solution providers. They empower safety leaders to keep their people safe through their solutions by taking their safety culture from compliance to caring. We thank EcoPortal for their support of the NSCA Foundation webinar series. We encourage you to visit EcoPortal online at ecoportal.com to learn more about the tools that they have to offer. Membership is crucial for the NSCA Foundation to continue its mission to protect the asset that matter, your people. We would like to thank our Platinum partners for their continued support and would like to welcome all of our Platinum partners joining us here today. On the screens are our upcoming events. These are available to register on our website. We're excited to extend the nomination period to the 31st of July 2026 for the 33rd National Safety Award of Excellence. Presented by us, the NSCA Foundation, this award celebrates outstanding achievements, innovation, and leadership in safety across the industry in New Zealand and Australia. If you or your organization have been driving meaningful impacts in safety, we strongly encourage you to submit your entries. The award ceremony will be held on the 5th of November here in Sydney at the beautiful Shangri-La. We'd also like to acknowledge our major sponsor, HSI DunSafe, for their support in making this event possible. Submissions are now open, deadline extended to the 31st of July 2026. We look forward to celebrate your achievements. Before we get started, I would like to bring your attention to the chat function, which can be found to the right of the video player, so please feel free to share your experience and comments with fellow attendees. We will also be taking questions at the end of the webinar today, so if you submit a question during the registration period, Mark will be answering them at the end of the presentation. But if you think of a question during the presentation, please submit a question through Ask a Question field located under the chat function, so we can have some lined up already. Now let's get underway. I'm really excited to introduce today's presenter, Mark Alston, the Director of Investigations Differently. Mark is a Director of Investigations Differently and a specialist in incident investigation, risk management, and learning from work. He works with organizations across mining, energy, utilities, construction, aviation, and heavy industry to improve practical risk management approaches. Mark facilitates investigations and risk assessment, supports leaders and frontline teams, and to promote scenario-based method focused on stronger controls and measurable outcomes. So now let's welcome Mark to present.
Hi. I think I'm there. So welcome everyone, and it's great to see we've got a good group in this today for our lunchtime meeting, and so thanks everyone for coming. So let's get into it. So welcome. We're going to talk about risk assessments, and I don't know about you, but I'm certainly seeing a lot of tick and flick out there, a lot of tick in the boxes with them, and a lot of just about. Is that a lot of questions? Have we done the risk assessment? But really, we're not looking any deeper. We're just filling in forms. In fact, we're getting so good, we just copy and paste the previous one, change the dates, change the task, but the controls are the same. They're all green. And they're not adding value. and everyone's bored. Like, when's the last time you had a risk assessment workshop that people were excited to go to? How many of your people that you invite to a risk assessment workshop are like, yay, I can't wait, I can't wait. And in the end of the day, we struggle to get numbers, we struggle to get the right workers. Everyone's disengaged, copy and paste. People with agendas set the tone, and we're just getting things done. So this is the current state of play. Plenty of people are like this, and we've got to work out a better way of doing things. And so today we're going to go over some practical tips that you can take away from today and apply later on. So you'll be able to, those that are registered can obviously download the recording or look at the recording later on, but we don't give out the slides, but they're all in the recording. So what are the 5 things we're looking at today? So the first one, the first tip is we're going to change from restating what we already know to discovering uncertainty. We're going to explain what that means. Understanding risk is just in everyday work. It's in a variety of work, and understanding that comes from discovering how work is really done in the field and not how we imagine it to be done. Developing credible risk scenarios that are reasonable and plausible is key, and not focused on the things that are just possible, as anything's possible. And this is probably where I'm spending my most amount of time now, is actually, are we being really honest about our controls and their effectiveness? Or are we being dishonest with ourselves, and are the controls providing false assurance to our leaders about how we've managed the risk? And lastly, it's ditching the tools for the risk workshops, and I'll explain more what that means. So I guess my first question for this, and if we're all in a room, I'd love to get feedback. My first question is this: is do we actually know what the definition of risk is? So, like many things that we have, everyone's might be familiar with ISO 45000 and various other standards that are out there, and international standards and Australian standards. But there is actually one for risk management. And it's been around for a long time. Personally think it's due for an update. But it actually provides a real definition of risk. Now, too often people are defined, when I ask this question, what's the definition of risk? Even health and safety professionals aren't real sure what the definition of risk is. They use terms like consequence, likelihood, hazard, and all these sort of terms, which are around how we assess risk or how we look at risk or what a risk could be, but they don't actually define risk. So if we actually look at what the standard says this: it's the effect of uncertainty on objectives. Now, horrible. Not exactly the most exciting definition we're ever likely to see. But if we break it down, the objective of, say, a construction company is to make money constructing whatever their clients want. That's their objective. The objective of a hospital is to treat patients effectively and send them on their way healthy and recovered from whatever ailed them. The objective of safety is quite simple. It's just to keep people safe. So if that's our objective, keep people safe, it's the effect of uncertainty on doing that. The effect of uncertainty on that objective. So what is uncertainty? Uncertainty, there's things, other words we could use: unsure, unknown. We don't quite understand. Lack of understanding. These are the terms. That's what risk is. Risk isn't what we know. It's what we don't know, what we're unsure about. And that's what we should be identifying rather than restating what we know. And look, it's not just in the ISO risk management standard. It's actually in the code of practice. So the model code of practice says this: it should be done when there is uncertainty about how a hazard may result. There's a lack of understanding around how hazards interact with each other. And let's face it, no single task or workplace has one hazard. So there's always different hazards interacting. Right? We're uncertain about the impact on the effectiveness of control measures. That's the stuff we don't know. That's when we should do a risk assessment. And it actually gives us even more guidance about, well, when don't we need to do one? And we don't need to do one when there is a code of practice or guidance. How many of us have done risk assessments on use of mobile plant? Where's the uncertainty there? Probably in the effectiveness of our controls. Are we risk assessing the effectiveness of our controls? Have we identified that as our risk? Work at heights. There's a whole range of these common high risk tasks that we do in our organisations that we keep doing risk assessment after risk assessment after risk assessment, and people get bored and they just copy and paste and they're over it. We've just got to look at the effectiveness of control measures. That's where our uncertainty lies, not in the knowns. And one of the things I find really useful to sort of sort out this knowns is a thing called the Johari window. And it comes from the 50s and was two psychologists, Luft and Ingham, and they developed the Johari window to think about how they see themselves in context or contrast with how other people think about them. And it's quite thing. So there's the known knowns, the known unknowns, the unknown knowns, and the known unknown unknowns. So if we think about the known knowns, that's all the stuff we already know, right? We already know about, for instance, driving, and we already know about forklifts and things like that. So our risks that we need to do aren't the basic risks of operation. We've got to look for the uncertainty in using that forklift or driving that vehicle. Where's our uncertainty lie there? What aren't we sure about? Right? Example, the known unknowns. These are our more classic risks. So we know about them, right? But we don't fully understand them. And a classic example is like an inexperienced workforce. So today, I deal with a lot of like manufacturing, construction, all sorts of industries. And, I ask them a question and I say to them, 20 years ago, how long would have someone been in your industry to be considered experienced? And they'd say, 20 years. Now you ask them how long someone need to be considered experienced. They say a year. 6 months longer than anyone else. And now they're experienced, we call them. But we've got this inexperienced workforce. Another example is English as a second language. How many of you have English as a second language workers and large parts of workforces? Do you know the impact? Do you know how that's affecting how work gets done? What language are all your procedures and instructions and training in? More likely than not, the English. I know there's outliers and a lot of people are doing great work and have multiple languages in their workforce, but a lot don't. The unknown knowns. And this is where probably the most interesting things we can discover lie in here. And that is where this untapped knowledge of our workforce, right? They really know these things that are going on and they've worked out how to deal with it, but we don't know. And quite often we see that expressed in deviation from our procedures or as workers imagined. It's these things that they're doing that we just, they're doing them. We just don't know about it. We just see the jobs get done. So we just assume they've done it as per the procedure or the risk assessment. That's fascinating to me. Right. Then we have our unknown unknowns, the black swan event. Now, for everyone but healthcare and aged care, the black swan event, these are the things that we weren't aware of, didn't think could happen, weren't even sure of. The proverbial meteorite strike. But for we go back 6 6-7 years now. Geez, just seems like it was not that long ago. COVID-19 for just about most industries except those I expressed. No one ever thought about pandemic, and even for pandemic for the healthcare and aged care, they had pandemic, but they did not know the impact or the scope that a true global pandemic would have. So the question is, where do you want to spend your time? Where do you want to spend your time? Do you want to spend it in the stuff you know about or the stuff you don't know about? And for me, it's the stuff I don't know about. Because when we get to when we get to the end of it, when we get to the objective, what we're really trying to achieve is risk assessments that provide managers with accurate information about things they're not sure about, or things they don't understand, things they're uncertain about, so they can understand them. They do know what risks they're tolerating, right? And they can implement controls to reduce to so far as reasonably practicable, or whatever your standard is in your particular industry, right? Like nuclear and others, it could be achievable, or all those sorts of things. Have we learned enough in those risk assessments to know that we can put effective control in so our people will fail safely? Because humans will make mistakes. Humans will make mistakes. So quality risk assessments are about providing risk assurance to our leaders who provide the resources. That's what they should be about. They shouldn't be what they are now. And if we really are honest with ourselves, and if you look in your organisation, and I should probably reframe this question to, when do you get asked to do a risk assessment? I think that's probably, I might reframe this. When do you get asked to do a risk assessment? And more often than not, it's to justify a decision that's already been made. We've already decided we're going to buy that new piece of plant or equipment. In fact, it's turned up. We've already decided we're going to do that task. We're going to do that, build that building. We're going to erect that scaffold. We've already decided we're going to do that crane lift. The problem with that is when we've already said we're going to do it, effectively we've said it's safe enough for us to do. All we're doing now is justifying why we've said it's safe. And I know a lot of you have been in a room where, or even if it's a SWIMS or a job safety analysis or a Take 5 or whatever the stupid tool that is, you've been there and people have gone, hang on, we can't have it orange. Oh, let's add an extra control and that'll make it green. And that's what we're doing. We've already said it's safe. So the outcome's we've already said is so far as reasonably practical. So that we've got to stop doing that. We've got to stop doing that. We need to start doing risk assessments before decisions are made to identify and control the risk before we make that decision. That's what we've got to do. So get off the merry-go-round. Stop doing it. Stop doing these risk assessments that justify decisions. We have to get our way into the decision-making process before they make decisions. Now, one of the things we can do is work simulation or work planning. And I can tell you now, when I've asked for a work simulation meeting or work planning meeting, I get far more investment and engagement from the stakeholders than if I say, we're doing a risk assessment. Because this is how they know they're actually going to have to do the work. And we can focus on the knowns. This is what we're going to do. It's a planning tool, right? We can brainstorm different things about how we might do something. It has to have people who are doing the work. We need to go through the process. And the good thing is if there's something that people aren't sure about or is unknown, we can go, okay, well, we'll just have to do a risk assessment on that. And we can do that later. We'll put that to the side and we'll do a risk assessment and we'll see about how we do that. And we don't need to reassess known risk. We've already done that. I guarantee you, most organisations keep repeating the same risk assessment. We've done that. What's the effectiveness of controls? Is there unsurety about that? Then let's look at that. Otherwise, let's get into it. So that's tip one. Tip one, stop risk assessing everything and focus on your unknowns, your unsure, your uncertains. That's what risk assessment's about. The things that keep us up at night, the things we worry about, that's what we need to risk, because we're worrying about them because we're not satisfied that we've got it under control. And that's risk. So that's tip one. Tip one. Tip two, how do we learn about this unsurety? How do we learn about what this uncertainty is, what the unknowns are? They come from the discovery of normal work. They come from the discovery of context. And this is actually slightly annoying, because if we look at the ISO 31000, the first step is identify context. Unfortunately, the Safe Model Safe Work Code of Practice doesn't include that in their model. I don't know why. But context comes from understanding the conditions of work, the conditions of tasks, the conditions about how something will be applied in a specific environment. Right? That's what we want to understand. Because when we look at it, we call this the black line and blue line. And I refer to Todd Conklin, and he wrote an excellent book, probably started me off my journey about doing things differently, called Pre-Accident Investigation by Todd Conklin. Work is imagined, work is done. Work is imagined is that procedure. Always has a happy ending. Risk is always mitigated so far. But in reality, our workers can't follow them all the time, and they don't. There's all these things that are pushing them all the time. Production pressure, goal conflicts, different equipment, job demands versus job resources. Every hazard in every code of practice pushes them. Not having enough people, having too many people, their peers, their colleagues, themselves. There's that expression, there's so many ways to skin a cat. Well, there is. There's so many ways that a task can be done. And this is that variability of everyday work. And this is where it intersects with risk. So these are the things that why workers do the job or the task the way they do it comes down to these things. And it's not in a procedure. So how do we learn about it? It's not in the risk assessment. So how do we learn about it? Right? We have to discover, because what we're asking is why it makes sense to them as a workforce to do the work the way they do it. That's what we're trying to get at. That's what we're trying to get, is why does it make sense to them to do it this way? Because they won't do stuff that doesn't make sense to them unless they're forced to. That's when they do stuff that's only when they're forced to do it, and they don't believe in it, then they probably don't do it properly anyway. So why does this make sense to them? And if we're going to do that, we need to learn about the context of the work. And there's a whole heap of ways we can do that. We can go into the field, right? We can watch work. Now, unfortunately, just being there could alter how they do it. But the more we're in the field, the more they get used to us, the less that affects them. We can do work tasks. And we involve those people in do it. Brainstorming, learning teams, those of you that looked at it, reviewing incidents, not findings of incidents, the context of the incident, learning those things, asking better questions to learn about how we do that. And we've got to be curious. And look, this is from that TV series Ted Lasso. If you haven't watched it, cannot encourage you more to watch it. I think it's like the first or second episode, he talks about, he gets into a discussion with someone and it's all about being curious and not judgmental. Because just because we think it's a way to do the task doesn't mean it's a way to do the task. So being curious. And secondly, having the right people in the room. I would love for our industry to draw a line in the sand and stop doing risk assessments at their desk by themselves, would stop doing risk assessments with just supervisors or leaders, actually having the people who do the work in the room for the risk assessment. Because a supervisor has different context, a leader has different context. Multiple workers will have multiple contexts, and that's the ones that do the work. They're the pointy end. They're starting to prosecute safety professionals for doing dodgy risk assessments. They are. There was a case recently up in Bundaberg in Queensland where they prosecuted the safety person over a risk assessment. So we've got to get better at that. We've got to draw a line in the sand and start doing them properly. Only do them if you've got the right people. If you don't have the right people, then don't do the risk assessment, and it means your organisation isn't serious about assessing the risk. And you have to call them out on it. Because if you don't, we're left carrying it, and we're not doing ourselves any favour. I cannot be more passionate about this if I try. That was tip 2, and I'm going okay time-wise, I think. Tip 3, risk isn't static. There's all variations of risk. Driving a vehicle in a car park at 5 kilometres an hour is a completely different level of risk, different level of worst case consequence than driving on a country highway in the dark and the rain. So a risk convention has been in existence for a long time now, and it's that credible worst case scenario or credible worst case consequence we have to do. We have to identify that. The thing is, they must be plausible, credible, and reasonable, this worst case scenario. And too often it's not. So when we look at this worst case scenario, obviously it's the most unpleasant thing or serious thing that could happen in a situation. A specific situation. The scenario must be specific, right? Credible, plausible, reasonable. An example. If I'm walking through a car park and I trip over my own 2 feet, which is highly likely as I get older, the credible most likely injury, I'll get my words straight, the most likely injury for me is some grazes. Some grazes on my hands and my knees, right? Ego probably is the worst damage I'm going to get, right? By falling over in a car park. Now, could I die? Well, yeah, because anything is possible, But for me to die, think of the scenario that would require me to die. I'd have to fall over, hit my head on a rock, suffer a subdural hematoma, not get care in time, and all these other things would have to happen. I could get hit by a car. Okay, well, that sounds credible at first glance, but hang on. Let's line up everything that would mean that I would die. Because there has to be a consequence, right? So I would have to fall over exactly before a car came at the exact same set moment, and that car would have to be speeding at such a speed that it wouldn't be able to avoid me or stop and hit me with enough impact to cause a fatality. Wow, that's a lot of what ifs. The credible worst case injury for me falling over, in reality, is probably a broken bone from my sticking my hand out and getting some sort of break. That's probably the credible worst case injury. It's what's credible, not possible. So I use that in risk assessment workshops. I use that when I'm explaining risk to leaders or workers. I use that example, and you can do one in your own workplace, right? To help explain what we're looking for, because too often we're either, risk assessment workshop for safety, we're either killing everyone or no one's getting hurt at all. It's that balance about what's credible. That's what we're after, plausible, reasonable. And that comes from the context of the work. That first step of my workshop, in any risk assessment workshop, is always about identifying the context of the work. They will tell you what's credible when you have the right people in the room, because they know, because they do it every day, right? Writing credible risk scenarios involves 4 ingredients. It's really simple. It needs a hazard, an interaction between the hazard and a target, and it requires a consequence. There must be the 4 ingredients for there to be a risk. Must be the 4 ingredients. If there's no consequence, there's no risk. So for those of you who have risk matrix descriptors, you know those risk descriptors where it describes what a minor, medium, major, serious, blah, blah, blah has. If your one at the very bottom has 0 consequence, then it's not a valid descriptor for risk, because without consequence, there is no risk. Because we're always assessing the likelihood of a consequence when we go to assessment. So without consequence, with the likelihood of 0, mathematically incorrect, right? Everyone knows anything times 0 is 0. So 0 consequence, 0 risk. 0 potential consequence, 0 risk. So must be a consequence for there to be a risk. And when we talk consequence, what I encourage you to use is those descriptors. So this is quite a common one that I put up on the screen. Minor to critical, first aid to fatality. That's how we should describe it. So when we're describing our risk scenario, we don't use terms like injury. We don't use terms like damage. We actually specify the level, the credible worst case consequence in accordance with our risk matrix descriptors that we have in most risk procedures. The good thing about that is when we go to do the risk assessment, we've already got consequence, and now we're just arguing about likelihood, right? So they must have the 4 ingredients, and the consequence has to align and use the same terminology as your consequence categories or your consequence descriptors in your risk procedure. Target, interaction, hazard, consequence. Pedestrian, crossing busy road, fatality. Every single risk scenario should have the ability to identify the 4 ingredients. It doesn't matter if it's a bow tie. It doesn't matter if it's a RAC, so workplace risk assessment control. It doesn't matter if it's a SWIMS, right? You should be able to clearly identify the 4 ingredients. The 4 ingredients must have the consequence, must have that. Controls. Ooh, controversy time. So what is a control? It's a task. It's an object. The task object that either reduces the likelihood of a risk event occurring or reduces the impact. Right? It's not a procedure. It's not training. It's not something that just analyzes. It must be like a technical bit of, like a guard. So guard's an object, interlock object, or an act. It can't be a procedure. They are not controls. So some good guidance comes from the International Council of Mining and Metals. They've got they've just released their 2026 version of critical control management, and they talk about what controls are and what they aren't. Controls are procedures. They're guidance. Now, still important, but they shouldn't be in your risk assessments as controls. And one of the ways and the controls need to be specific. They need to be specific. So don't just, like, too often I see things like PPE. That's the tail wagging the dog. Or I see these motherhood statements, inspections, maintenance, bunding, whatever it might be. There'll be common controls, supervision, inductions, training. They're not controls for a start. What we want to see is specific. If we say PPE, what's specific PPE? Right? Riggers gloves, that meant a specific Australian standard, whatever that is, and I didn't put it in because I don't know it, and I didn't want to look at it. So, If we're going to say inspections, when? Frequency, who? We're going to see servicing and maintenance of equipment, when? How often? These need to be in there, because what we should be able to do from these controls from risk assessments is pop that in a procedure, put that into our safety management system so people know. And one of the things I really do in my workshops is when I'm talking to the team about what controls we're going to talk about, I tell them, I don't want to hear about generic controls like supervision, training, inductions, take 5, swims, procedures. I don't want to hear any about that. I want to hear about controls that are specific to this specific risk, that aren't generic to a whole heap of other risks. And what that does is it enables the workshop to focus on that risk and on controls that matter. And not just cut and paste the 15 we've got from the cell or row above. That's what I'm after. And we need to use the hierarchy of control properly. We need to start pushing boundaries. We need to be able to get our people to fail safely, because too often we don't. And when we look at things, so I'll give you an example. Forklifts. No. Cars. Let's look at cars. Modern cars at the moment have all these safety features. They have everything from lane collision avoidance to adaptive cruise control, accident avoidance, and then all the other engineering things. So if you do have an accident, airbag, side impact protection, blah, 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 blah. Why do they put them in? Because we know that humans will crash their cars. Yet you look at forklifts in your organisation, if you have them, or forklifts in general. What have they got that hasn't been around for the last 50 years? Wow, we've got a reversing buzzer, a flashing light, and we've got some falling rolled object protection. Right now, you can go and buy and retrofit an AI 360 camera for 10 grand or less, or whatever it might be, around that sort of figure, to your forklift that would automatically stop it hitting a pedestrian. Wow. Why don't we have those controls? We're just too used to not pushing the boundary. And we're too used to this hierarchy of control as being a label. We put the control in, what's that belong? Where does that belong? Rather than using it as a process. So we've got to start using the hierarchy of control as a process. The first thing we should be asking the team, can we eliminate the risk? Can we eliminate it? Can we substitute? Can we isolate? Can we engineer? Before you even worry about admin controls. I'm not worried about admin controls. I want to know what else we can do to actually reduce risk. Because this is what it says. Eliminate or reduce it so far as reasonably practical. Minimize it. Right? If you were to go to your risk registers and all your risk assessments and remove all the admin and PPE controls, what's left? How many risks would have 0 controls? Got to do better. Now, recently, in the last couple of years, I've come across this, which I found fascinating. It's from a paper by Hassel, Joy, Doran, and Punch from 2015. So it's over 10 years old. It's 11 years old, this paper. And they wrote this, and it's called the Selection and Optimization of Risk Controls. You can look it up. You do have to pay for it. It's not available free, unfortunately. Otherwise, I'd share it. But you have to pay for it because it's copyrighted. But this I find fascinating. This is about being honest about the control quality and the control effectiveness. So it gives this. Now, yes, it is still slightly subjective, but if you're involved in critical control verification and have real assurance over the effect of your controls and their implementation in the field, independent assurance activities on these will actually make this data more quantitative and less qualitative. So you can get to a quantitative state using this matrix. So the first question it asks is, how much human interaction is required? Right? What's the coverage, availability, and reliability of the human component? So they do it. So if you look at our example there, it's working where we follow a set rest. Well, we know 90-95% of the time in our organisation they do, and we get that from various, interactions and observations and field studies, right, and incidents and blah, blah, blah. Then we look at what's its coverage and reliability of the technology itself. And we know that we've got plenty of harnesses, they're readily available, and they're maintained, and they're there. So again, we can actually get some quantitative data from there. And then that gives us an idea of the control quality. Now, if you were to put a procedure in that, I think you'll end up probably around, the very poor or poor mark if it was just a procedure. Then we take that result, so the result there is very good, and we go to control effectiveness. We pump very good into the system, and then we go, what's the impact of that? Significant, some, slight, no, or adverse. And we know if people are wearing full restraint, it'll have significant impact on their survivability. Same with the seatbelt. And that gives us our rating for what the effectiveness of that control. And then there's guidance on what we can do with that. So if you have a number of controls, you can run this test over your controls, and you can look at, you might have 5 controls for a particular risk. You run them over, and if most of them are very good, you probably have a reasonable argument to say you've got good effective controls. If they're coming marginally or poor, I'd suggest you haven't reduced your risk to so far as reasonably practical. So this might be new for people. I'll just go back a couple of slides. That's it there. Selection and optimization of risk controls. So really cannot more strongly advise you to have a look at that. If you want more information, reach out, and I can help you out, but I can't give you a copy because it's copyrighted and they charge for it. Just like they do standards. This, I think, is where we need to start being really honest with ourselves about the effectiveness of our controls and not just filling in forms. Lastly, ditch the tools for the workshops. So when I run a workshop, a risk assessment workshop, I don't have a computer. I don't put up a bow tie on a wall. I don't put up an Excel spreadsheet or anything like that. I don't put up a form. I simply use whiteboards and flip charts. And we're brainstorming. I'm looking for risks. And there's 3 things I want out of that workshop. I want to know the context of their work. I want to make sure we've got with the team, they agree these are the credible risk scenarios. And then I'm focused on controls. Those are the 3 things, because we quite often only get people in risk assessment workshops for a very short period of time. So this is what I'm focused on. So don't let the tool drive how you do them, because all you're doing is filling in a form. That's all you're doing, right? Create that space, right? Get the honesty, right? And then after it, just take photos if they're whiteboards and then transfer it to the form. Or if they're flip charts, you've got them. Or what I'm doing these days is I'm recording everything, still have a scribe, and then I'm using AI, approved AI by my organisation. There's a whole set of rules around using it to help me identify key risks and controls and make sure I've covered everything. Work smarter, not harder. Have we identified or reasonably foreseeable risks is your first question you've got to ask. That's what burnt Dreamwell. They didn't identify what the regulator said was a reasonably foreseeable risk. Whether you agree with it or not, that's what the regulator said. And the second question is, do our controls legitimately eliminate or reduce it to so far? That's what we want. So, summing up, moving from justify a decision to learn and reduce systemic risk, from filling out a form to discovery and understanding, From things we know to discovering what we don't know, from generic risk to specific risk, from generic controls to specific controls, from filling out a form and paperwork to managing risk. And I reckon I've got time for one bonus tip is ditch the matrix. Ditch the matrix. There's so many issues with this. It's just colouring in, right? It's we've either eliminated or reduced the risk so far as reasonably practical, or we're not. A risk matrix just needs two colours, red or green. That's all it needs. There's a whole lot of issues, from ordinal issue misuse to poor resolution, all sorts of things. And I do not get any risk assessment workshop to do this. I've already got the credible consequence. Later on, after everyone's gone, I'll use additional information to determine likelihood if I have to fill in the form for an organisation. If I don't have to do this, I don't. And in fact, I've got clients now that are ditching this and aren't using this at all because it adds zero value. Zero value. Well, I think I've timed it okay. I was looking for 45 minutes, and I think I've pretty much done that. That's me, and I'm sure you'll be able to connect. So on LinkedIn, that's our website. Message me, email me, call me, whatever you want. Keep in contact, and yeah, if anyone's got any questions or thoughts, I'm ready for them.
Hi, Mark. I'm just gonna stop your screen sharing and we can do the Q&A. So I'll put the first question on the screen. How best can risk assessment can be communicated and implemented on the front line? That's a question submitted during registration.
Your implementation comes through your procedures. Frontline risk assessments don't work. There's no scientific evidence they do work. In fact, the only proper scientific study was done by Griffith University with Yopavinger and someone else, Andrew Ray, a few years ago at Urban Utilities, and they discovered that the correlation of doing like take fives and things like that just doesn't work at the front line. It's PCBU's job to manage risk, so therefore you don't need to communicate a risk assessment to the front line. You communicate the controls. You implement the controls. That's what needs to happen at the front line.
Okay. Well, thanks for answering. I'll archive this one. Next one. How to improve quality and effectiveness of controls to achieve measurable reduction in risk?
I think I answered that with the.
Yes.
So this was a question that was sent through like 40 odd minutes ago.
Yes.
So using that control quality and effectiveness matrix, for me, I love it, and I would build that into a system and gathering data from my other systems that I have, such as critical control verifications, observations, inspections, audits, incidents. And I would build that data and get quantitative data from that with some qualitative data from workers, with interviews and surveys. And I would build my control effectiveness around the quality and effectiveness tables, which that paper talks about. That's how I would do that.
Amazing. Thanks, Mark. I'm going to archive this one as well. If anyone have questions, submit now. Well, we got Mark still here. We only got one more question lined up. Did you answer this one as well during your presentation? Do you have any suggestions on how to verify effectiveness of the most important controls?
Yeah, I think that's the same.
Okay.
The only thing I would say, though, is too often our CCVs, so for those that don't know, critical control verifications as CCVs, focus on whether or not a control is in place. Look at your wording for your questions that you're getting people to answer, and instead of in place, ask the question, is it effective? Is it effective? So will it be effective? So look at the effectiveness of that critical control verification. So that would be the only thing I would do. So apart from what I've already suggested, really look at the language. So one of my clients, Mitchell Services, Josh Bryant, just recently went through every single CCV question he has, and he has changed them to be about the quality of the critical control and the effectiveness of the critical control. So it's not about whether it's a yes or no. It's about, will it be effective if we have to use it? If it's engaged, will it be effective? And that's where they've changed their focus. So real focus of effectiveness is what we're after now.
Cool. Thank you. We don't have any questions lining up. So do you have anything to add on for this presentation? Thanks again for presenting today.
Look, I know I gave a heap of stuff out
you
in a very short period of time, and I flew through it. But I was very conscious I wanted to leave some time if anyone had some questions, and thank you for those questions. Look, at the end of the day, we've got my biggest pet. I don't know if you picked it up. I'm very passionate about having the right people in the room. I'm very passionate about going and looking at the risks first. So site visits, going in the field, seeing where it is with the people who do the work. That's where we discover uncertainty. That's where we understand context of work, and then focus on that. Get rid of the matrix. Get rid of the bloody forms. The forms are what is the administrative component that we need to do. Yes, but they don't help workshops. And if you make it about the workshop, it's just all you're doing is filling in a form. Every single one of us, I bet, has been exposed to someone doing a take 5 or something like that, and it's a tick and flick. A tick and flick. And they write the same things down the same time, day after day after day, and they add zero value. We do not have the capacity in any organisation to do things that don't add value and don't provide a return on investment. So my advice for you is your controls should have a return on investment. Your return on investment is they reduce risk. They're not reducing risk, then why are you bloody doing them? Why are you doing them? You're just wasting time. You're creating bureaucracy. We've got enough bureaucracy. Declutter, focus on effective, focus on quality, and focus on reduction of risk. And yeah, look, happy to chat to anyone. Reach out. Yeah, connect on LinkedIn. Catch up at any stage, and I'm more than happy to have a discussion about it. And we can talk to you about some options if you're looking at anything else.
Amazing. Thanks, Mark. Great closing statement. I'll be sharing your contacts with all of the attendees post-event as well. Thank you, everyone who stayed till the end. Hope you have an insightful session and take some knowledge you learned today back to work. We will be sending a survey after the event as well and the recordings. Looking forward to see you at the next event. And thank you so much, Mark, for presenting today.
No worries. My pleasure. Thanks for the foundation. And yeah, thanks, everyone.
Thank you. Bye-bye.
Thanks. Bye.